Hi, you guys. Welcome back for our daily practice questions. It is day 169 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it's free and linked in the description. Also, my website is linked in the description where it shows you all of the resources that I offer for first time test takers and those of you who may be retesting. All right, y'all, let's get into question number one. All right, so a 35-year-old patient presents with an itchy, red, vesicular rash on both hands after using a new cleaning product. What is the best first line treatment? Is it A, oral corticosteroids for 3 months? Is it B, systemic antibiotics? Is it C, avoidance of the irritant and use of topical corticosteroids? Or is it D, an antifungal cream twice daily? Take a moment and tell me what you got in the comments, y'all. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So, here, the stem of the question states, what is the best first line treatment? And I always tell you, if they're asking for a treatment, you need to look and see if a diagnosis has been provided. And if it has not, then you got to go look at the assessment findings so that you're able to determine what it is, because you got to know what it is to be able to treat it. So we don't have a diagnosis here. So we got to look at this assessment. We have a 35-year-old patient. They have itchy, red, vesicular rashes on both hands after using a new cleaning product. Y'all, this is classic for contact dermatitis, right? And contact dermatitis, think about it's explaining to you that there has been an irritant that has caused this, and then it responded the same to the area that came into contact, right? So that's where the contact dermatitis come from. So, what is the first line treatment for contact dermatitis? And your best answer is going to be C, because you want to avoid the cause, the source, the irritant. So, avoid the irritant, and you can use topical corticosteroids to help aid in the inflammation and itching. So, more symptomatic management. Question two. A 9-year-old child presents with fever, headache, and a petechial rash that started on the wrist and ankles and spread centrally. He was recently hiking in a wooded area. What is the most appropriate treatment? Is it A, azithromycin? Is it B, amoxicillin? Is it C, doxycycline? Or is it D, Cipro? Take a moment and tell me what you got in the comments, you guys. All right, so stem of the question states, what is the most appropriate treatment? Again, if they're asking you for a treatment, you got to run it back and see if they provided you with a diagnosis. And if they have not, you got to go check out these assessments and determine what you got going on, right? So this 9-year-old child has a fever, headache, and a petechial rash that started on the wrist and ankles. This right here is classic. The fever, the headache, and then the final confirmation is that petechial rash that starts on the wrist and ankles. Classic for Rocky Mountain spotted fever, right? They've been hiking in a wooded area, so you're thinking, potential tick bite. Then they have this presentation, Rocky Mountain spotted fever, okay? So then you need to think about how we treat with this. And your best answer is C, doxycycline. And then lastly, question number three, a 4-year-old child presents with chronic itchy skin, especially in the creases of the elbows and knees. What's the most appropriate first line therapy treatment? Is it A, oral corticosteroids? Is it B, emollients in low to medium potency topical corticosteroids? Is it C, topical antibiotics? Or is it D, high potency topical corticosteroids? Take a moment and tell me what you got, y'all. All right, all right. Stem of the question states, what is the most appropriate first line treatment? So let's see what we have going on because there's no diagnosis provided. We have a 4-year old comes in with chronic itchy skin, especially in the creases of the elbows and knees. One is chronic, right? And it's happening in the crease of the elbows and knees. Y'all, the flexural folds, classic for eczema, aka atopic dermatitis. So remember, we just did this the other day, but I wanted to give you another example with a different presentation so that you're able to pivot, however, and make sure that you're familiar with this. But B is your best answer. Emollients and low to medium potency topical corticosteroids is your best answer, right? That's your first line treatment. All right, you guys. As always, I hope you found this helpful. Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website, and my website is also linked in the description. If you go straight to the website, it provides you all of the resources that I offer, and it shows you what works better for first time test takers as well as those who are retesting. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.